3 tips for overcoming emotional trauma. Just let it go. It's over now. Get over it. When will you be back to normal? To most cancer survivors, advice like this can feel patronizing and shallow. If letting go were so easy, then a woman's battle with cancer would end when her treatment ended. But you've been fighting a war, and the scarring is more than just physical. Breast cancer survivors often experience emotional trauma, even as physical side effects of both the treatment and the cancer diminish. About 1 in 4 women develops PTSD after breast cancer. Whether from the cancer treatment or the fear of recurrence, emotional trauma is real and should be taken seriously. That's why we're here to help you tear down the emotional barriers. With the right strategies, support systems, and positive action, many women learn to cope with the trauma from their breast cancer experience. The shift begins as women stop thinking of themselves as a patient. And here are some suggestions of where and how to start. But first, we'd like to thank our sponsor, Breast Cancer Index. It's a test that may help women with ER-positive, early-stage breast cancer decide with their doctor whether to extend or end anti-hormonal therapy after 5 years. Number 1. Mindfulness Technique. Simply put, mindfulness is keeping your total attention on what's happening right now, on a moment-by-moment basis. By doing so, you learn to soften the attachment to what's happened in the past, things like suffering through treatments. Mindfulness also helps you to quit obsessing about things that haven't happened yet, such as recurrence. Think of meditation and how focusing on the present moment gives you mastery over your thoughts and feelings instead of being controlled by them. We recommend finding a reliable source, such as a local clinic or hospital, that offers mindfulness-based stress reduction, also known as MBSR. Or, if it's not available to you, a meditation practice is a great place to start. The concepts are similar, although MBSR is research-based and is conducted by medical professionals. One excellent resource is Mindful Living Programs, which not only teaches classes in its home of Chico, California, but also offers an online program through mindfullivingprograms.com. Number 2. Resist the urge to hibernate. Social interaction is a crucial component in releasing the bonds of past trauma or post-traumatic disorder. Connecting with others can be calming and relaxing. It also helps us to get out of our own heads. If you want to boost the effects of social interaction, make the connections while doing a physical activity such as walking, group exercise, dancing, or just about any sport that puts you in motion. According to the Anxiety and Depression Association of America, there are many benefits of exercise, including better sleep, less stress, and less pain. The body's natural endorphins that are released through exercise can be as effective as medications. But to get the best of both worlds, do physically active things with people on a regular basis. Outside. Instead of the treadmill, go outside for that walk in nature. When we're outside, we're more present in the moment, which draws our attention away from the hopelessness and helplessness. Another excellent activity that reduces the impacts of emotional trauma is helping others. For most people, being in service to others reestablishes a sense of gratitude. Being part of a greater community can help you feel reconnected and powerful. Making an effort to help others by focusing on their needs reminds us of our optimism. Volunteering is a great way to remind yourself of your strengths. Number 3, talk to your doctor. But be honest. Let your doctor know if you have feelings of hopelessness or if you feel self-destructive, and ask for a referral to a therapist who is clinically trained to help cancer survivors. Many major cancer centers now include a psychologist on the treatment team, because for most cancer patients, nothing is normal. Treating the patient and not just the disease has brought the focus of recovery to every aspect of the patient's experience. Women report that regaining their peace after cancer isn't some grand revelation. There's no ultimate moment of epiphany, just an awareness that peace now exists, where before was only fear. What seems like an impossible battle gets swept away by life's progression. Be patient. Time truly can heal wounds. To get more practical tips for breast cancer patients, be sure to subscribe to Breast Cancer Answers here, and leave your own questions in the comments below. We'll do our best to answer your questions in future videos. Finally, we'd like to thank our sponsor, Breast Cancer Index. To find out more about your treatment options beyond year 5, just click the button and download our free list of 15 questions to go through with your doctor.